So I just really want to talk about planning for a moment. I know that all of you are probably facing a headwind of urgent tasks right now as you're getting ready to reopen. You know, you're lining your staff back up and getting the word out and preparing and crazy, busy. But it's also important to plan for a few things, to take a moment, take a breath, and think through what things you need to to get ready for. And I guess really the first part of planning that would be important is planning to implement all of the requirements that we're going to be walking through today. And there are a lot of things to put into place, and so having a plan that kind of has the who's going to do it, when are they going to do it, how are they going to do it, and kind of getting that on paper so that you don't miss anything important, is a key component to having your plan. And another very important planning piece is scenario planning. And what I mean by that is to really prepare. I mean, we're again excited that we're reopening now, but the truth of the matter is that none of us know what's going to happen, right, in the next 6 to 12 months. It certainly, we hope not, but it certainly is a possibility that we could go back under a shelter-in-place order again, and it's a really good time to have a plan to get ready for that. What are the things that you really want to be ready for, as far as staffing, communication plan to your staff of what's happening, communication and marketing plan for to your clients, whatever you want to tell them, financial planning to be able to to sort of I guess live through and survive another shelter in place if that happens. Just really important to have a plan in place, as opposed to we go along and one day you wake up and here it is, and you're not ready for it. So we encourage that. Another part of your plan we would recommend is marketing. You have an awesome opportunity to get an important message out to your customers, of course, right now, which is the fact that you are reopening, if you indeed are, and what your hours are. They need to know that. And wherever you normally market, if I'm sure all of you have some degree of an online presence, it's really important to put that information there that you are open and ready for business, and here's what your hours are, and be consistent with that information on wherever your information sits. So your website, your Google business page, your Yelp page, wherever your information is, make sure that's on there and it's consistent. My wife and I wanted to go to a restaurant a couple nights ago, and we're like, okay, are they open? And we went on, I think it was their Google business page, and it said that they were open, but then their website said that they were not open. So we were confused. So just, the point is just be, we want to get that word out and be consistent with it. Speaking of marketing, another really important message to include, particularly for the services that you provide, is the fact that you are a safe place for your customers to come back to, that you are compliant with all of these requirements, and you've gone above and beyond. You've trained your employees and all the safety processes, and some folks are still going to be concerned about coming back and doing anything, whether it's eating out or coming and getting their nails done or whatever it is. So the better that we can communicate the fact that you are prepared and it's a safe place is definitely a message you want to get out. And any kind of goodwill type of thing that you can do, maybe you have a special time of day that you offer your services to more vulnerable, populations or seniors or something. A lot of folks have been doing a lot about that. But anyway, just really important. This is not a time to quit marketing. This is a time to absolutely, get the word out about what you're doing. So the last piece of strategic planning would be around budgeting. Just really important, rather than just say, look, we'll see what happens. Come up with a plan. What is your best estimate of your revenue forecast for the next, month, or at least 2 weeks? What do you believe that's going to be? What is your goal actually for what that will be? How many services can you provide, and what does that look like? And then, of course, the other side of the budgeting ledger is your costs, and certainly to be careful about scheduling your staff so that you can be in a operate in the black, which we all want you to do. You want to do that, so just continuing to budget as you go. Obviously, you don't know exactly what to expect over the next couple months, but I would really pay close attention to what those numbers are, and adjust for the trends as you go forward over the next few months. Now, some resources for you. I want to encourage you to go to the Solano SBDC website. It's solonosbdc.org. And when you get on our homepage, there's a button at the top right that says COVID Recovery. If you click there, it will list a number of different resources that are available to you. One of the first things you'll see there is an action plan template. And really what that is a Word document that is really a planning tool. It will allow you to plan for these 4 things that I've just been talking about. So you can put your own information in there and create your plan. So if that's helpful, that is on the website. There's also a What's Next recorded webinar series that's there that covers all of these topics more in depth that you can listen to. And I encourage you to do that. And while you're on the website, I encourage you to go to apply for services. The SBDC provides so many resources for you, training, classes, events like this webinar. But we also have a team of business advisors. We have 15 business advisors made up of folks that are highly experienced business people that can work with you. They can help you with this reopening piece. They can help you with the SBA loans if you need help with that. We've been doing a lot of that work over the last couple months. They can help you with marketing and how to sort of reestablish your business and continue to bring more and more clients in. And the best thing about that is that one-on-one advisor can work with you at absolutely no cost to you. It's a resource that's provided because the SBA sponsors this, the state of California sponsors this, and our 4 cities, including the city of Fairfield, sponsor the SBDC. And they do that so that we can provide those services to you for free. So I encourage you to take advantage of that. So while you're on the website, you'll see a red button that says apply now, and you just click there, and that will start your process to become an SBDC client. And we would absolutely love to be able to help you. Some other resources that I want to mention that are available from the Workforce Development Board, and you can find out about these on their website at solanoemployment.org. A couple of programs that I would mention, we have something called an OJT program. If you want to bring on new employees, that's a program that can help pay for a good portion of the salary that you would pay a new employee. It's called the OJT program. We have also a training program that will cover costs for training new employees that can save you lots of money. And we also have a program called the Layoff Aversion Fund. And this provides, it's a grant that you can apply for. Anything that really helps you keep from having to lay people off. There's money available to help you. So whether that's PPE equipment, whether that is, equipment, software to help your employees to be able to work from home. We've provided, a lot of resources there. So again, all of those you can find information on at solanoemployment.org. So with that, covering the business stuff, we're now going to switch gears and look at the this compliance information. And to do that, I'm going to turn it over to Ms. Heather.
Yes, and I just want to add one thing about the resources from the WDB. So unfortunately, as of yesterday, our layoff aversion program has closed. If we do have additional funding, we will open it back up so you can come back and check. But at the current moment, all of our funds are expended. However, Tim talked about the training piece for incumbent worker training. We can support some of the training pieces around COVID-19 reopening. We're going to talk about some of the staff training pieces that are required, maybe training on personal protective equipment, and that is a dollar for dollar match. So there are opportunities for kind of that financial support as well as it relates to your employees. For Fairfield, our business services consultant is Sonia Rockwell Jackson. And before we're done, I'll put her contact information in the chat so that if you're interested in those pieces, you can reach out to her and she can give you more information. Okay. All right. So we will go ahead and start the reopening guidance. I'm going to move your pictures here. Okay. The reopening guidance around what the state calls expanded personal services. So just giving you kind of a general concept of where we are with reopening. We started reopening the county in early May, and the county put out guidance organizing it into low risk, medium risk, and high risk. And it was based off of the spread of or the threat of transmission. The state came out the same day in the afternoon with guidance organizing it by industry. So there was some early kind of maneuvering to do to get those two pieces on the same track. Right now, we are in stage 3. So all of our county low risk has been opened. We are now in the medium risk piece. Essentially what medium risk is where you're going to have groups of people that are going to be close together, like religious services, alcohol establishments, museums. And then also, and this is where expanded personal services comes in, where you're going to have close contact and potential touch with body. And that's why we have, for this piece of it, nail salons, estheticians, I'm really bad at pronouncing that word, cosmetology, electrology, massage, anything, tattoos and piercing, anything where you are essentially touching the body as part of your service, that falls under this expanded personal services. Okay, so spas would be part of this as well. I did see one question about swimming pools. That is open as well from a hotel standpoint, and we did a presentation. Tim, what was that, Monday?
Monday, yes.
Monday, yeah, we did a presentation on Monday on that. And by the end of the week, that will be posted on our YouTube channel. So you'll be able to get to that recording from either the SBDC website or from the solanoemployment.org website. So on all of these pieces that have opened up so far, we have done a webinar on them, and you can always go back and you can look at that. One of the things that we've really been saying is that if you are an establishment that does multiple services, like a hotel would be a good example. You might have a restaurant and a spa and a pool and the hotel piece of it. Make sure that you're looking at the guidance for each of those activity pieces of it, because there is different guidance and different considerations for the types of things that you are doing, okay? And then stage 4, and this is still to be determined, equates to the county's high risk, and this is where you're going to have large groups of people, concerts, convention centers, event centers, live audience sports, festivals, theme parks, anywhere where you're going to have multiple households coming together in close contact. And that's the piece that we are not at yet as far as reopening. Okay. Are there any questions about what can or can't be open right now?
Yes.
Yeah.
So I have a question. I've been trying to reopen my shop, but I've been trying to be ready. How do I can approve? All the guidelines. Do you guys send somebody come in and check on us to see we are approving or?
So no one will come to check. We're going to talk through all of the steps and the things that you need to do. The main thing that we are finding is it's not that the city or the county or the state's going to come to check. It's that your customers are not going to feel comfortable and they're going to call the authorities. So it's really about making sure that your customers are aware of what you are doing and that you are following the proper guidance, because that's where all of that kind of checking and following up with businesses is coming from. It's from customers that have come in and called the city or the county.
Uh-huh. And so do we making the rules to be limited people in the shop, or what we doing, like less than 10 people in the shop or something?
Those are great questions, and we're going to go over all of those questions.
Yeah, because I'm concerned about that.
Totally understand.
Yeah.
Okay. All right. So there's two kind of levels of guidance. There's the state guidance and the county's guidance. Solano County's reopening guidance relies very heavily on the state piece of it. On their website, and when we go to questions, I can post that they have reorganized their website to have the local and the state guidance side by side. So if you go to solanocounty.com and click on the COVID-19 piece of it, there's a really good chart and really good breakdown of the different industry pieces that are allowable in the county and the state guidance on that. The county kind of between the county and the state, these are really the categories of requirements. The county and the state call them slightly differently and organize them slightly differently, but the content is the same. So one category to look at is going to be signage and the signage that you put up. 2 is employee considerations. 3 is going to be the social distancing, which that question relates to, and how you reduce contact. And then the last piece is around facility sanitation. And I will forewarn you, in this industry, there's a lot of considerations for you guys to think through around sanitation, okay? So what we'll do is we'll go through each of these, and as we go through them, if you have questions, please feel free to either ask them or to put them in the chat. Tim will be managing that piece. And we'll just go through each of these in detail, okay? All right, so from a signage standpoint, and remember that this PowerPoint is in the chat, so you're welcome to download it and print it and use it for a reference. The other things that are in the chat is the state guidance for expanded personal services, and then the latest county order that came out on June 16th. And then the last piece in there we're going to talk about on this slide is this chart or this flyer right here that says we're ready to reopen responsibly. So for the public signage requirements, at your public entrance, you are supposed to post information about your written plan for social distancing, is what they call it. So there is a social distancing protocol for this industry. What the county has asked is that you print out the state's guidance and you essentially use those bullets and check yes, yes, yes. One thing that I would highly recommend, just having lived in a regulated world in my career, is to look at the difference between musts and shoulds. Look at the difference between required and consider. Okay, so if it says consider doing this, that's not a requirement, it's a suggestion. If it says you should do this, it's not a requirement, it's a suggestion. But if it says you must do this, that is a requirement. Okay, so just to kind of help you make that distinction on that checklist. And then the county, in that order that is in the chat, there is a cover sheet that you are going to fill out that you will then combine the state checklist and that cover sheet. And that becomes your written plan for social distancing. Okay. They've made changes in the past week. It used to be that you had to post that at your public entrance. Now, just because it's such a massive document at this point, what they have done is this sign, "We're ready to reopen responsibly." Once you have completed that worksite plan, you'll post this on your public entrance. So, "We're ready to reopen responsibly. We've done all of the requirements for the county and the state. Here's the person to contact if you have any questions." And then they ask that you make that plan available upon request. So if somebody comes in and says, "Hey, I want to see your worksite plan," you're supposed to be able to provide that to them upon request. So maybe have a couple copies of them in the back, and if somebody asks, you can just give it to them. But this flyer is the only thing that actually needs to be posted. Okay, does that make sense? Okay. The other thing that has to be posted at your public entrance and for public viewing is COVID-19 guidance for employees and customers. So if you see the other flyer behind the Reopen Responsibly, CDC has a lot of really good print resources. My suggestion to you is don't reinvent the wheel. So what the guidance for employees and customers that has to be posted are your basic COVID-19 pieces. Stay 6 feet apart. What the county calls respiratory etiquette, cover your cough or sneeze with a tissue. Don't touch your eyes and mouth and nose. Wash frequently, wear a face mask. Those are all of the recommendations for COVID-19 guidance. And those are all on this flyer right here. So you can go to CDC, you can print it, post it, and have that piece taken care of. You'll see at the bottom of the slide, I did put the links where you can get these flyers easily. So CDC, again, I said, has a variety of flyers related to COVID that are just ready to print and post. Solano County also has some. There's a link to the Reopen Responsibly piece. And then the other thing I want to highlight is signs.com put together probably about 50 different signs that businesses can use during COVID, anywhere from wear a face mask to we're now open, just a variety of pieces. So just to make it as easy as possible, these are a couple places you can go and you can print those. Okay. And then the other thing that is required is that whatever social distancing markings that you use in your facility, to make sure that you have signs directing customers to use those, reminding customers to use those. Okay, so that's the public signage piece. The employee signage piece is that these also need to be in an area visible to workers. So if you have a break room or you have an office or wherever kind of your employees congregate, make sure that you have that guidance there as well. The written plan for social distancing that you do, that's something that you're going to need to give to all of your employees, so they are well aware of what your facility's guidance is around social distancing and COVID-19. If you have, I know that in this industry, it's not really a telework industry, but if you have employees that are teleworking, then you will need to give that to them too via email or whatever platform that you have. Okay. And then if you require any additional hygienic practices on top of the required ones, make sure that your employees know that as well. The other signage that you're going to want to make sure that you put up in wherever your employees congregate is the Families First Act employee rights. We'll talk about this in a little more detail, but under the Families First Act, it created paid COVID leave options and expanded FMLA leave options. And Department of Labor requires that that sign now be posted with your other HR materials. So wherever you have your HR board, you're going to want to print out this Families First employee rights and post it there as well. And you'll see at the bottom that there's a link to go directly to that poster. Okay. Any questions on signage? All right, that's the easy part. So the next kind of grouping of considerations is around employees. So these are the 4 areas to consider as it relates to employees. The state and the county guidance both require that you do some kind of staff training. The things that they want you to cover are methods to prevent transmission, making sure that your employees know your specific site protocols around COVID-19 and the transmission, an overview of what the symptoms are and what they should do if they're sick, and then any personal protective equipment that you're going to have them use, make sure that they're using them properly. And there are some really good videos out there around like how to use disposable gloves properly and face masks properly. The other piece is around sick employees. So you do want to inform employees, do not come to work if you are sick. CDC has some good flyers around that you can use as well. We've used some of those to post on our staff door. The other requirement is that you are to provide screening of employees for symptoms at the start of their shift. And you can do that in one of 2 ways. You can do screening of employees once they start shift on site, or you can direct them on ways to do self-screening before they come in. And different businesses are kind of on different perspectives as to whether or not they want to provide that screening themselves on site or whether they want to direct employees to do it ahead of time. But you are supposed to provide screening of that. And there are some CDC tools that the county and the state point to in their guidance that you can use if you choose the self-directed piece. Okay. And then the other thing to remember is that if employees come to work and they are exhibiting symptoms, and it now becomes kind of a health question, like is it allergies or is it COVID? And that's something that we have to work through more now. But if they are exhibiting symptoms, you're going to want to send them home. One thing to remember with that is that you are still held to the reporting time pay requirements at the state level. So if they come to work 15 minutes in, you send them home, you're still required to do the reporting time pay of at least 2 hours. Okay, so just keep that in the back of your head. Protective equipment, there's a lot of detail around protective equipment for this industry, so we'll go into that detail and we'll go into that in more detail in a minute. And then the last piece is around workers' rights. So we'll talk about the COVID leave piece, but the other thing I want to highlight, and as of right now, this goes until July 6th. We'll wait and see if the state extends this, but May 6th, the governor put out an executive order around workers' compensation. And essentially what that says is while we are under shelter at place, employees are supposed to just be going to essential places, right? And so if they are working and they contract COVID-19, they have a diagnosis of COVID-19 and they have been working in the past 14 days, it is assumed that they got that or contracted that on the job. And so therefore they are covered under your workers' compensation. So I would check with your workers' compensation individual and just kind of make sure that you know the nuts and bolts of that piece of it so that you're prepared in case that happens. Okay. And then the last piece is that the county makes it more specific to identify a COVID-19 supervisor that will ensure that your protocols are being met on site. So this supervisor needs to be on site at all times. So if you're open like 8 to 5 and you have one supervisor that's going to be there the whole time, it can be one person. If you have multiple shifts, then you're going to want to identify multiple supervisors so that whatever hours you're open, you have a COVID-19 supervisor on site at all times. Okay. Are there any questions on this? All right. Just a very quick overview on the Families First Response Act. So this allows 80 hours of paid sick leave at employees' regular rate or 2/3 of pay, depending on what the reason is that they need the paid sick leave. And then it also provides an option for expanded FMLA related to childcare. So in the middle are the reasons why someone would be eligible for Families First Act. This is a right that they have. So we are already starting to see cases coming out from Department of Labor of people getting back wages for not receiving this paid sick leave. So you're going to want to make sure that you pay attention to this. It applies to any business with less than 500 employees. The good thing is that it is a dollar for dollar tax credit. So the federal government is paying for this leave on the back end, and you don't have to wait till the end of the year. You can put in that credit on your quarterly payroll taxes. There is a possible exemption for businesses with less than 50 employees, specifically for the child care piece. So on our website, solanoemployment.org, underneath our COVID resources, we do have frequently asked questions for businesses, and there's a lot of detail around the Families First Act if you want more information on that. Okay. Any questions on the paid leave? Okay. All right. So there are a couple of specific things that the state put out for employees in expanded personal care services. All of your employees have to wear face coverings. Some industries it recommends it, some occupations it requires it. Because you are in close proximity to someone, and because you are actually going to be touching bodies, you must wear a face covering. They do recommend, particularly for like skin care and for nail salons, that you wear a face shield for eye protection, so that if things splatter, that the eyes are also protected in addition to the face coverings. The other thing too, and this just says disposable gloves for tattooing and piercing, but it's throughout all of the different pieces of it. When you are touching somebody's nails, you're touching, like when you're doing the cosmetology or the esthetician's piece, make sure that employees are wearing disposable gloves. Again, it's to make sure that the employee is protected and the customer is protected. They also really highlight lots of hand washing in this industry. So that may be something that you want to incorporate into your staff training. Constant hand washing. I know that we have a number of massage therapy individuals, and they really highlight wash before and immediately after the service. Okay. Another thing too is that they're even recommending that workers in this industry wear some kind of scrubs or clean launderable smocks. That way you're not getting virus onto your clothing, and you're able to kind of mitigate as much transmission spreading as possible. Okay. One thing that in a lot of our industries we don't think about as an employee piece of it is you're going to want to provide time for your workers to add cleaning practices into what they do. Because this is a lot about sanitation and about social distancing and reducing contact and disinfecting, you may want to consider having some of that built into workers' time, or bringing on somebody that does that specifically.
Hey, Heather, can I interject something?
Absolutely.
We had a question in the chat from Pamela. It says, does the sick leave apply to sole proprietors as well? Is paid leave just for W-2 employees or self-employed sole proprietors as well?
It's for W-2 employees.
Thanks. Keep those questions coming.
All right. Perfect. Okay, so that's the employee-related guidance. The next kind of category of information is around social distancing and reduced contact. The general concepts of this is that you want to limit how many people are together that are not in the same household. If they're in the same household, they're already kind of their own little germ bubble. But you want to limit cross-household interacting as much as possible. There is a lot of recommendation around using physical barriers in this industry, like in between your nail salon places, if you do like pedicures or any of that, where you have your customers close together or like in chairs next to each other, putting up physical barriers if you cannot separate them at least 6 feet. Okay. The other kind of general thing is you're going to want to eliminate any customer self-service items. So if you have mints, or you have a coffee station for your customers, or you have a magazine rack for your customers, those are things that you're going to want to remove during this time. Okay. And then the last piece to this is to use contactless payment systems as much as possible. You want to reduce how much you're receiving cash, and think about how you're being paid, and is there a way to reduce the touching that goes along with that. Okay, so those are the overarching concepts. There are some specific pieces for this industry that are part of the state guidance. So they do say that customers must wear face coverings during the entirety of the service. Again, protecting the customer and protecting the worker. They do say if you're not doing something on the face. So like if you're doing something on the face, obviously they don't have to wear the face coverings, but when that piece is done, they want the face coverings to go back on. One thing to think about is to consider staggering appointments, so that if you have a lot of people kind of congesting in your reception area, or you have a lot of appointments coming in at one time, try and stagger those so that you have less people waiting together. And if you have the ability, look at like a virtual check-in technology, or something to kind of do, maybe like a text reminder or something like that. So think of ways that you can kind of mitigate the people coming in and reducing the time that they're together in that waiting area. This would be a really good time to say, come by yourself. Don't, and if it's a minor, obviously a parent or guardian, but you don't want additional friends and families coming with them. You want to take out that social piece of it. The other thing that they've made suggestions on is maybe you can call customers ahead of time, or like an email ahead of time saying, reminder, if you're experiencing symptoms, let's reschedule you. Make sure that you're checking yourself beforehand, make sure you wash your hands before you come in. So you can absolutely send some of that guidance out ahead of time when you make the reservation or when you make the appointment. And then whatever your guidelines are for customers when they come in, you're going to want to make sure that you post that so that they can easily see what you are asking them to do when they come in. Okay, does that make sense? Okay. So kind of the next piece of this is reduced contact, and some of this is very specific, so there's a lot of reference here, and you can find the ones that fit you specifically. So anything that's a single-use item, whether it be cardboard files, whether it be disposable sandals, whether it be applicators, whether it be any of the equipment that you use, if you can do them in a disposable way, that's going to be preferable. If you can't, you're going to want to sanitize them between each use. And that's really the bottom line of it. One of the things that they talk about, particularly for nail salons, is to remove the nail polish displays. Maybe use a color palette or something else so that you're not having people touch items multiple times, or multiple people touching items. So anything that you can do, the way that I kind of describe it is to stand in your facility, look around. Where do you tend to have congregations of people? How can you mitigate that? How can you try and provide more separation? And what things do people touch over and over again? And can they either be removed, or make sure that you disinfect them on a regular basis so that they don't become items of transmission spread? So that's the bottom line of it. There are specific pieces on this. I know we do have a lot of massage individuals, and by the way, I am super excited that massage is coming back. When I was pregnant, I missed margaritas and sushi. During COVID, I missed massages. So I am super excited to schedule like with all of you guys and get like 10 massages. Just want to throw that out there. But for the massage piece of it, they do say like provide your hand treatment last, so that you're touching the hand last in your piece of it. Consider facial massages and whether or not that's something that you want to do. Make a choice on that. If you are doing something that has chemicals in it, like nails, estheticians, skin, consider having better ventilation for that. So those are all kinds of different types of considerations.
I have a quick question.
Absolutely.
I've heard multiple dates. Is that going to be this Friday that we'll be able to open, or is that going to be more like the 29th? Because I'm hearing two different dates.
It is June 19th. And if you take a look at the county guidance that's in the chat, it specifically says allowable June 19th. So they are matching up the date with the state.
Okay, thank you.
Okay. So the last category is around facility sanitation. And just because of the nature of this industry, there's a lot of sanitation requirements and recommendations that both the county and the state have. So these are kind of four major areas. Before you reopen, you're gonna wanna make sure that you sanitize. Sanitize everything. And any food, make sure that it's safe, like clean out your refrigerators, all of that kind of stuff. But the CDC has a really good reopening disinfection tool. It's probably the most easy to understand out of all of the reopening, and it has specific guidance on what types of chemicals you need to pay attention to, what types of things to clean. So you can click on this link and go directly to that, but you're gonna wanna sanitize before you actually open the doors. Once you do have your doors open, you're gonna wanna make sure that you routinely clean and sanitize. The two things to really pay attention to is anything that is going to be touched multiple times and any areas that are gonna have multiple people in it on a regular basis. So again, it goes back to where do you have areas where you're going to have congregation in general, and what types of things are touched on a frequent basis. Those are the two things that you want to try and mitigate as much as possible in your facility. Okay. And this piece is new for us, is we now have to think about cleaning as part of our everyday way of work. So think about, do you want to assign cleaning tasks to employees, or do you want to bring in somebody to do that? I would suggest having some kind of cleaning schedule. One of the things that we did, we've been open as an essential business. And one of the things that we did to help people feel safer is, you know, like when you go into a bathroom and it has like, this bathroom has been sanitized, ... we started putting those up, well, obviously in all of our bathrooms, but also in all of our public spaces. And the things that, like our computers that people touch regularly, we have little cards that say this station has been sanitized. So those are some little things that might help you to be able to do that and kind of organize the way that you clean and keep it sanitized. And then the last piece of this is that you're going to want to provide sanitation options for your customers. So wherever you're going to have high touch interactions, where people are touching things frequently, or where you have people congregating, like at your entrance or checkout counters, provide hand sanitizer or disinfecting wipes. I will tell you, disinfecting wipes are very hard to come by right now, but the hand sanitizer works pretty well. And we've seen more people using hand sanitizer and essentially turning it into a spray to be able to disinfect things. So I want to forewarn you, you are going to have to get creative with your sanitation supplies because they are in scarce supply. But there are also a lot of local companies that are kind of redoing how they do stuff. There are some local distilleries that have created hand sanitizer. Heretic Brewery in Fairfield has created germ juice. That's alcohol-based sanitizer. So there are some local companies that are doing creative ways for that. And Debbie may have some good connections with businesses that have been kind of repurposing. Okay, so those are the general concepts. Remember I said that there are some specific pieces for this industry. Think of where you have porous surfaces. So where like virus can get into things. Chair seats, for example, things that can't be easily disinfected because they are porous. Maybe your massage table or something like that. Think about, and again, it says consider, so it's not a requirement, but it's a suggestion to do some kind of plastic or disposable liner on that surface, or clean and disinfect it after each use. Okay, so that's something that kind of in this industry there is more of, and to think through that. Any of your shelving or display cases, kind of the industry-wide guidance is to not have samples, to not have things that you can touch, like the sample lipstick or the sample aromatherapy bottles or the sample nail polish, those types of things. You're going to want to remove them, or if you need them for your service, make sure they are clean and disinfected. Also, one thing that they really pay attention to in this industry is that sweeping isn't as good as vacuuming. So if you can vacuum and vacuum with the HEPA filter, then you're going to be able to clean up those pieces rather than just sweeping. So again, that's something to consider. Again, it says where possible. So it's not a requirement, but it's something to think about. There are, particularly like in massage, for example, or maybe some of the cosmetology or the spa pieces, you're also going to want to think about the linen piece of it. So if you have linens, you're going to want to use disposable gloves when you are removing them. They give more detail in the state guidance, like don't shake them because you're going to shake the virus everywhere. They give you guidance on how to make sure that you are cleaning them properly and at the right temperature. So do think about your linens and making sure that whatever linens you use, that those don't become a spread of transmission. Okay. And then it goes into a lot about the implements and the tools that you use. For anything like tweezers or scissors, you're going to want to wash them with, they talk about hot soapy water, EPA registered disinfectants. So making sure that those types of things are cleaned between each use. If you use electrical implements, then you're going to want to use some kind of spray or wipe just to remove the physical debris from them. And then they also talk about things like disposable probes if you use those, or needles, or ultrasonic cleaning units. So pretty much any equipment that you use in your industry, you're going to want to make sure that you clean and disinfect them if you can't have a disposable option for it. Okay. Talks about wax pots and pedicure bowls. It really gets detailed into the specific types of equipment that you use in your industry. So it's a good kind of checklist to help you think through all of the different tools and equipments that you use and how to make sure that you are disinfecting them in a way that's going to mitigate that transmission. Okay. All right, any questions on the sanitation piece of it?
Yes, please.
Yeah, go ahead.
Yes. So I'm doing now. So like they even we have the plexiglass, plexiglass in the front of the customer. We still have to wear the face shield.
No, you wouldn't have to necessarily. The face shield is a suggestion. The face mask is a requirement in this industry, but the face shield is not. So if you have a plexiglass barrier that keeps that splattering from getting into your eyes, then you're okay.
Oh, okay. Yeah. Thank you.
You're welcome. All right, so that completes our presentation. We do want to be able to open it up for questions. Any questions that you had that we haven't answered yet?
Heather, we did have one question in the chat from Francis. She asked if all customers need to be served by appointments only. I don't think that's a requirement, but
no,
best practice.
Yeah, it's a recommendation. It's not a requirement. And I think part of the reason that they did that is businesses are of different sizes, so you may have just one person doing a massage, or you may just have one station for nail. It may be a very small boutique place. It may be a larger business where you have multiple people coming in at the same time. And so they did want to be able to provide that flexibility for that size piece of it. But the bottom line of that is that you want to try and make sure that you don't have multiple people congregating in your reception area.
I have one more, sorry.
Ask as many as you want.
Yeah, so I research a lot about like on different states they are opening, and then they say they require the customer have to wear gloves to come in. Do we have to require that because they don't know how they can
Yes.
wear gloves with that? So that's my question.
You mean cloth face mask?
No, glove. They have to wear glove on the hand.
Oh, gloves. No, that I'm sorry. I'm sorry. I heard cloth. They do have to wear a face mask. They do not have to wear gloves. You have to wear gloves.
Yeah, that's why I'm concerned because I searching all the stuff, before we opening, and then they all say like the customer have to wear glove, and I say they want to do nail, how to get.
Yeah, I don't know how you would do that. So the two pieces that are going to outline the requirements for any business in Solano County are going to be the state's industry guidance and Solano County's shelter at home order. Both of those are in the chat. Those are the only two that are going to give you requirements.
Okay.
Jorge, I don't think there are any city requirements, correct?
Yeah, I don't think so, but I just want to make sure everything we do the right way. So
we all appreciate that. Thank you.
Yeah. Okay. Thank
the
you.
State guidance and the county guidance. Anything else that you read is not going to be applicable to you.
Okay. Thank you.
Any other questions? Okay, Tim?
Okay, well, look, if you do have questions after this, know that we're here to help you. Reach out to us, either of our websites or to Debbie or Jorge at the city. We are all pulling for you. We're here to help and support. We're excited that you're getting back and reopening, and we just wish you all well. And thank you again for being on today. Hope it was helpful. All right, we're signing off. Thanks, everybody. Take care.
Bye.